Helicopter Flying Handbook 11.1 Helicopter Emergencies and Hazards. Today, helicopters are generally reliable. However, emergencies, whether due to mechanical failure or pilot error, are anticipated. Swift and precise recovery is crucial, facilitated by a thorough understanding of the helicopter and its systems. Discussion and practice of emergency procedures, including autorotation, are essential. Knowledge of conditions leading to emergencies can help prevent accidents. Autorotation is a power-off maneuver where the engine disengages from the main rotor, and the rotor blades are solely driven by upward airflow. It is commonly performed in engine or tail rotor failure scenarios. A freewheeling unit disengages the engine when its RPM is less than rotor RPM. In autorotation, lowering the collective immediately reduces lift and drag, initiating a descent supported by upward airflow. Tail rotor control is maintained with anti-torque pedals. Several factors influence autorotation descent rate, including bank angle, density altitude, gross weight, rotor RPM, trim condition, and airspeed. Airspeed and rotor RPM control descent rate, with different helicopters having specific efficient power-off glide airspeeds and rotor RPMs. Reference to the Rotorcraft Flight Manual or RFM provides helicopter-specific information. The glide angle is critical during autorotation, requiring pilots to experience autorotations from various airspeeds for better control understanding. Collective pitch control manages rotor RPM, and if it builds too high, raising the collective decreases RPM back to the normal range. If RPM decreases, the collective must be lowered to maintain proper rotor RPM. Keeping rotor RPM within the recommended range is essential. The helicopter's glide ratio is less than fixed-wing aircraft, necessitating an instinctive choice of airspeed and rotor RPM based on existing conditions for a suitable landing area. In conclusion, thorough knowledge of autorotation and emergency recovery procedures is crucial for helicopter pilots, ensuring safe and efficient handling of unexpected situations. Regular practice and understanding of helicopter-specific factors contribute to effective decision-making during emergencies. In low-inertia rotor systems, the management of rotor RPM during power-off autorotations, especially during entry, is crucial. Simulator flight evaluations emphasize the simultaneous application of aft cyclic, down collective, and alignment with the relative wind or trim across various airspeeds, including cruise airspeeds. The specific procedures for safely entering an autorotation vary among helicopter makes and models, and it is essential to refer to the applicable Rotorcraft Flight Manual or RFM for guidance. Understanding the collective's role in rotor RPM control during power-off autorotations in turns is vital. Raising the collective reduces RPM, while lowering it increases RPM. Cyclic movement, typically associated with attitude or airspeed control in powered flight, also plays a role in rotor RPM control during autorotations. A parallel line of cyclic movement with the flight path contributes to increased rotor RPM, especially when the helicopter's flight path deviates from its longitudinal axis. During the transition to autorotation from cruise flight, pilots must promptly apply simultaneous down collective, aft cyclic, and anti-torque pedal inputs to prevent undesirable pitch changes and rotor RPM loss. Failure to do so, as identified in accident investigations, often results from delayed or incomplete control inputs during a real power failure at cruise airspeed. Low-inertia rotor systems, storing less kinetic energy during autorotation, experience rapid rotor RPM decay during deceleration and touchdown. Conversely, less energy is needed to regain safe rotor RPM during autorotation entry and descent. In autorotation training, the application of aft cyclic, when rotor RPM has decreased, helps rebuild rotor RPM. This should be done at a moderate rate and may be combined with a turn to increase airflow through the rotor system. Care must be taken to avoid overspeeding the rotor system during this process. Regarding autorotation training, the Advisory Circular 61140 provides enhanced guidelines, particularly for the 180-degree autorotation. Risks inherent in performing autorotations in the training environment are acknowledged, and this section outlines an acceptable means of training, though not the exclusive method. Straight-in autorotations, made from altitude with no turns, are affected by wind conditions. Headwinds result in a steeper glide angle, impacting the touchdown speed and ground run. A headwind contributes to a slower touchdown from an autorotative descent, requiring accurate timing and speed of the flare. Care is crucial during the flare to avoid tail rotor contact with the ground and potential damage to the helicopter. As proficiency increases, pilots may reduce ground run while maintaining a controlled landing. To practice autorotations effectively, as the maneuver depicted in Figure 11.2, which illustrates a straight in autorotation. Initiate the maneuver from level flight at the recommended airspeed, cruise or manufacturer's recommendation in an altitude of 500 to 700 feet above ground level, while heading into the wind for optimal practice conditions. Begin by smoothly lowering the collective to the full down position as shown in position 1 and use aft cyclic to maintain a proper attitude, preventing a nose-low position while ensuring rotor RPM stays within the green arc. It's crucial to note that when the collective is fully lowered, rotor RPM is controlled by mechanical pitch stops, set during maintenance to allow for autorotational RPM even under conditions of extreme vertical loading reduction. Coordinate collective movement with anti-torque pedal adjustments for trim and use cyclic control to maintain the desired airspeed. Decrease the throttle after fully lowering the collective to achieve a clean split or separation of the needles, indicating disconnection of the engine from the rotor system. Adjust the throttle to keep engine RPM above normal idling speed, avoiding needle rejoining. Refer to the rotorcraft flight manual for autorotation rate of descent recommendations. As depicted in position 2 of Figure 11.2, adjust the attitude with cyclic to attain the manufacturer's recommended autorotation or best gliding speed. Use collective adjustments to maintain rotor RPM in the lower part of the green arc. Aft cyclic inputs increase rotor RPM, controlled by a slight collective increase, while avoiding large collective movements that lead to rapid rotor RPM decay. Approaching the recommended altitude, the position 3 is shown in Figure 11.2. Initiate the flare with aft cyclic to reduce forward airspeed and decrease the rate of descent. Maintain heading with anti-torque pedals and ensure rotor RPM stays within the green range. Carefully execute the flare, avoiding abrupt or overly slow cyclic movements that could result in climbing or rapid settling. As forward motion decreases to the desired ground speed or usually the lowest possible, move the cyclic forward to achieve the proper attitude for landing position 4. The helicopter should be close to the landing attitude, with landing gear height around 3 to 15 feet above ground level, depending on the manufacturer's recommendations. Apply forward cyclic as necessary to return the helicopter to a more level attitude for touchdown. For a full touchdown landing, allow the helicopter to descend vertically at position 5, using collective application to slow the descent rate. Be prepared to apply the opposite anti-torque pedal used in powered flight due to friction within the transmission or drivetrain. Control response with increased pitch angles may differ slightly, requiring larger control inputs to maintain heading. In case of a power recovery during training instead of a full touchdown, follow the appropriate technique outlined in the training materials. After touchdown, lower the collective pitch to the full down position, and avoid attempting to stop the forward ground run with aft cyclic, as it may lead to rotor blades striking the tail boom. Common errors to avoid include holding the helicopter off the surface, failing to use sufficient anti-torque pedal, lowering the nose too abruptly, and failing to maintain proper rotor RPM, among others. Understanding the importance of immediate autorotation entry, proper pedal use, and smooth control inputs is essential for safe and effective autorotation practice. Autorotations with turns can be executed to facilitate landing into the wind or to avoid obstacles. The most common turns in autorotation are 90 degrees and 180 degrees. This technique outlines an autorotation with a 180-degree turn. The pilot begins by establishing the aircraft on a downwind heading, parallel to the intended touchdown point, and at the recommended airspeed. Adjustments should be made for wind conditions, maintaining a ground track approximately 200 feet laterally from the desired course line. Upon reaching the abeam position of the intended touchdown point, the pilot smoothly reduces collective, then decreases engine power to show a split between rotor RPM and engine RPM. Simultaneously, the pilot applies appropriate anti-torque pedal and cyclic to maintain proper attitude and airspeed. Throughout the autorotation, a continuous crosscheck of attitude, rotor RPM, airspeed, and trim or centered trim ball is crucial. The 180-degree turn is initiated after establishing autorotation airspeed. The pilot rolls into a bank of at least 30 degrees but no more than 60 degrees, maintaining proper attitude, airspeed, and trim. Pitted static airspeed indications may be unreliable during the autorotational turn, and caution is advised to avoid excessive pitch attitudes. Approaching the 90-degree point, the pilot checks the position of the landing area. The second 90 degrees of the turn ends with a rollout on a course line to the landing area. Adjustments to the bank angle may be needed based on the proximity to the intended course line. The helicopter should be aligned into the wind with the touchdown point after completing the 180-degree turn. If any criteria are not met or the helicopter is not under proper control at 200 feet above ground level, the pilot or instructor should abort the maneuver and execute a smooth power recovery and go around. Maintaining a stabilized approach, proper rotor RPM, attitude, and airspeed is crucial throughout the autorotation with turns. An immediate go-around is considered safer than attempting to recover lost rotor RPM. During the turn, maintaining altitude and coordinating flight controls is emphasized. The pilot's scan pattern should focus outside during the turn, checking attitude, ground track, and altitude. Considerations for autorotation at high-density altitude or DA include a higher rate of descent, reduced rotor RPM builds, low initial rotor RPM response, the need for a higher flare height, and reduced engine power performance. Common errors to avoid include entering the maneuver at improper altitude or airspeed, failure to maintain coordinated flight, and improper flare during touchdown. The pilot should be vigilant about avoiding common errors such as entering the maneuver at an improper altitude or airspeed, failing to maintain coordinated flight, and executing an improper flare during touchdown. Continuous practice and attention to proper procedures will enhance the pilot's ability to perform successful autorotations with turns.